I would say there is one big difference between AKFA Medical School and other medical schools in Uzbekistan. That is, AKFA Medical School has imported the whole 6-year curriculum from Gachon Medical School in South Korea. The curriculum in Korea is quite different from Uzbekistan, I think. So that will be the most important differences between AKFA and other medical schools in Uzbekistan. AKFA Medical School offers the best quality education in terms of the education content that came from South Korea. As you know, the education system in Korea is the best in the world. So we will use the right material, the best material in the world. So that's the reason why you have to choose AKFA University. And the second is that we have brilliant professors. They all speak English very well, and they are specialists in their field. So you can get good education from brilliant professors. And the third factor is that the AKFA company group, you know that company very well. That company group is supporting AKFA University very, very well, incomparably very, very well. For example, in order to construct our new campus, the company invested $200 million. That's a lot of money, right? And one last thing is that we educate everything in English. So if you study at AKFA Medical School, by the time you graduate from AKFA, your English will be very, very fluent. So wherever you go in the world, you can freely communicate with everyone in the world. Whether you go to South Korea, United States, one of the European countries, you will have no problem at all in terms of communication. So because of these reasons, I strongly recommend you to consider AKFA Medical School as for your further study. This year, we have 42 professors and 3 TAs. Among them, 12 are from foreign countries, and the rest, about 30, are Uzbek people. For AKFA Medical School, we have 14 professors and 3 TAs. We have 142 third-year students and 102 second-year students and 150 first-year students. AKFA Medical School has a good scholarship program, and among 360 students, 160 students are getting scholarships. Of course, the amount is varying from 100% down to 10% of the tuition. I said that Uzbek students are studying a little bit less hard compared to Korean students, but I don't think that's a real problem. Korean students are studying abnormally too hard. So they are under great pressure, so that is no good actually. So that is one of the aspects of why Korean people are unhappy, even though they are in a very well-developed country with high incomes. Too much stress is no good. So if our students are not too lazy, it's okay. I think the current level of their enthusiasm is proper, I think. So as they advance to the higher grades, I'm very sure they will study harder than before, just in order to survive the curriculum. The goal of AKFA Medical School education is to educate the students so that they can practice medicine right after their graduation. Of course, they will get training as an intern and a resident, but basically they can practice medicine at any time point without waiting so long. So if one of them wants to be a surgeon, they can start surgery anytime after graduation. Of course, surgeries are usually done by a team of medical doctors, so they can play a role as one of the members in the team. There are many different kinds of simulation at medical schools. One of them may be using a mannequin. In Korea, Gachon medical students are using very expensive mannequin that costs about $100,000. And when they touch one part of the body, there are so many responses from the mannequin. It's all automated. But there is just one small aspect of simulation education at medical school. The major part is called OSCE, OSCE. That is an abbreviation of Objective Simulated Clinical Examination, which means that students will have chance to treat a patient. That patient is not a real patient, and that patient is kind of a simulated patient. They are usually actors and actresses. They pretend like a patient. So when medical students interact with that simulated patient, SP, that patient expresses pains, and even though he doesn't have any pain, he complains about some kind of pain in the head and all different things, and he is really acting like a real patient. So students will have a chance to see he may feel like he's really seeing a real patient. So our students will have that kind of education program during their 5th year and 6th year. And that kind of education will be very helpful when they try to get a examination, medical licensing examination administered by the Korean government. So the Korean government medical licensing examination is composed of two parts. The first part is a written test, like the conventional examination. The second part is practice examination. So the examiners are watching how a student, the examinee, is acting while interacting with the simulated patient. So they ask questions and listen to the history of the disease that fake patient has, and do some physical examination and all kind of interactions. And also the examiner check the attitude of the student, how nicely treat the patient, and so on. So really, by watching the all behavior of the students, they marked how good this student is. And based on the mark, some students pass and some students fail the practice examination. So OSCE course during our medical curriculum will be very helpful to pass that the second part of the medical licensing exam. Both in Korea and in the USA. USMLE also have that kind of examination type. So when our students finish successfully the whole 6-year curriculum, they will be ready to take that kind of practice examination. On our new campus, we have a very nice, well-designed dental lab. So in that lab, we will have many mannequin and automated simulators. So our quality education for dental school will be very good too. Korean medical schools emphasize a lot about the third factor of a medical doctor. The motto of Gachon Medical School goes like this. We educate medical doctors with good skills, and medical doctors with the ability to solve problems, and medical doctors with warm heart, which means that we expect medical doctors with empathy for their patients. So we emphasize a lot for the third factor, there is empathy for patients. So that part is rather difficult. Any medical schools, any teacher can teach the first two factors. Good skills, lots of knowledge, and ability to solve problems. But educating someone to be a very nice person when they see their patients. That part is not that easy. So we've have special program to enhance that part. One of them is called Patient, Doctor, and Society. There is a series of 7 courses. They teach students with 7 different topics over 7 semesters. So I think that kind of curriculum is really unique compared to other medical schools. AKFA Medical School has a rather tough criteria for our students to graduate. If they get just 1 F, they should repeat the whole semester. That is called a flunk. When they get 3 times the flunk, they will be expelled from the school. So that means they cannot graduate as a medical doctor. So in order to graduate, in order to finish the whole curriculum successfully, they shouldn't get any F. So they should pass all courses. On our new campus, we have very good facilities so that our students can freely have chances to enhance their health and strength. We have a very good modern style sports center. In there, they can play basketball, they can swim, and they can do weight training. And outside of the sports center, there's a big soccer player field, and there are 5 tennis courts. So if they want to play anything, they can. It'll be very good for them to keep themselves healthy. Health is very important for medical schools to survive that very tough curriculum. So I'm very confident that AKFA University has one of the best environment in terms of health promotion for our students. Medical students in Korea studies 8 hours every day from 8:30 until 5:30. So they have 1 hour lunch break. So they keep studying 8 hours of study per day without any break, without any 1 hour long break except the lunchtime. So medical schools study really hard in Korea, but I don't think it's really a good thing. It's too much. They study like a crazy. It's a little bit too much. Our students have a little more empty time slots during the day. They study up to 6 hours per day, or sometimes maybe up to 7 hours. But in Korea, they have no empty time slot at all. So our students have a little bit more flexibility and freedom during the day. So I think that much workload for students is proper amount. It is very clear that AKFA University was established based on the presidential decree that was issued in 2017, and the AKFA company group started working on based on the presidential decree, and according to the resolution by the cabinet, our leadership visited Korea and signed the MOU between Gachon Medical School. So the whole purpose of this is to increase the medical education and healthcare service level in Uzbekistan. So if AKFA Medical School cannot meet all the expectations, it doesn't make any sense. And I'm very confident that AKFA Medical School will successfully meet all the standards and criterion. So people shouldn't worry about the accreditation of AKFA Medical School. So even at this time, even after we finish only 2 years of education, we have one specialist in accreditation. So he is working very hard to get accreditation from as many accreditation agencies as possible around the world. So I heard that these days he's contacting one accreditation agency in Germany, and he and I were working together to contact one of the US accreditation agency. No one should worry about the accreditation of AKFA University. When our students graduate the 6-year curriculum, they will definitely get a diploma that is accepted by anywhere, any place, any country. When they advance to the 5th year, they will do a lot of clerkship, which means that they will spend most of their time in hospital, in the university hospital, learning over shoulders of other medical doctors. I think so. Children's department is a very important part of the general hospital, so no doubt about it. Yeah, we will have a section for pediatrics. According to our curriculum, our students will be practicing in 30 different specialty areas when they advance to the 5th grade. So all clinical departments are included. So whatever you name it, our students will have a practice in that department. So the 4 major specialty areas are internal medicine and surgery and obstetrics and gynecology and pediatrics. Those 4 are the major things. And on top of it, as you know, ENT, ear, nose, and throat, and eye doctors, and who see bones and bone fractures. That is called, I forgot the correct word. So there will be all different kinds of specialty areas, clinical departments at our medical school. Of course, plastic surgery will be included. That is most popular sector of medicine. Most of the time, plastic surgeons treat healthy people who want to be more beautiful and spending a lot of money. So that's why plastic surgeons are earning so much money, because most of the customers are very rich people. So why not? AKFA Medical School definitely will have that specialty area. So a few of our students will be practicing plastic surgery in the future. Actually, medicine covers the both ways. When a doctor sees a patient, he should be able to treat that disease. And besides that, they do some efforts to prevent diseases in advance. So that is called preventive medicine. Preventive medicine is one part of medical sciences. Actually, our junior students are learning that subject, that course during this fall semester. There are many reasons why you have to choose AKFA Medical School when you consider to be a medical doctor. Most of all, the first thing is that AKFA Medical School offers the best quality curriculum that came from South Korea. And the second factor is that we have a very good team of professors. They are brilliant and they are all very smart. This year, we had 150 applicants for professor positions, and among them, we interviewed 67, and we finally selected 29 new professors. Among them, many are medical doctors who studied in one of the medical schools in Uzbekistan. Some came from abroad. Some are from India. Some from Korea. And there we have very good professors. So you can count on the education quality provided by our professors. And the third thing is that AKFA Medical School and the AKFA University is supported by AKFA Company Group. So we don't have any problem in terms of finance and budget. And the fourth thing is that you will be studying all 6-year curriculum in English. So when you finish your 6-year curriculum, your English proficiency level will be very, very high. And when you go abroad, you will have no problem in communicating with the global citizens. On our new campus, we will build a whole new university hospital with 600 beds. That's a quite big scale. And that'll be the best hospital, general hospital in Uzbekistan, no doubt about it. So if you come to AKFA Medical School, You can learn all courses from brilliant professors, and you can do practice in the university hospital. And everything is supported very well by the AKFA company group and good staff members and good professors. So I strongly recommend you to consider AKFA Medical School for your future career as a medical doctor.